Before performing nasotracheal suctioning, make sure the patient has no contraindications, such as a bleeding disorder, epiglottitis, or laryngospasm. Suctioning should be performed only as needed, based on the patient's condition and your assessment findings. After performing hand hygiene, help the patient into a comfortable position and put on a mask or face shield if splashing is likely. Then prepare the equipment. Attach one end of the connecting tubing to the suction machine and place the other end near the patient. If appropriate, and ordered by the physician, increase the oxygen level to 100% and encourage the patient to breathe deeply. This helps reduce the risk of suction-induced hypoxemia. Using aseptic technique, open the suction kit or catheter. Do not let the catheter touch any non-sterile surfaces. If a sterile drape is available, place it across the patient's chest. Fill the basin with about 100 milliliters of sterile normal saline solution or sterile water. Also open the water-soluble lubricant and squeeze a small amount onto a sterile surface, such as the inside of the suction catheter package. Now turn on the suction device and set the vacuum regulator to a medium level, or at the level designated by the physician's order or facility policy. Depending on facility policy, put on sterile gloves, or put a sterile glove on your dominant hand and a clean glove on your non-dominant hand. With the suction catheter in your dominant hand and the connecting tubing in your other hand, secure the catheter to the tubing. Remember that your non-dominant hand is clean and not considered sterile. To make sure the equipment is working properly, suction a small amount of normal saline from the basin. Then lightly coat the distal 8 to 12 centimeters of the catheter with lubricant. Using your non-dominant hand, remove the oxygen delivery device, if any. Have the patient inhale deeply. As she does, use your dominant thumb and forefinger to gently but quickly insert the catheter into her nares during inhalation, without applying suction. Follow the natural course of the nares, slanting the catheter slightly down. Do not force the catheter, but insert it about 20 centimeters. If you feel resistance at this insertion depth, pull the catheter back 1 to 2 centimeters because it may have hit the carina. If needed, position the patient's head to the right to help reach the left mainstem bronchus, or turn her head to the left to help reach the right mainstem bronchus. If you are unable to pass the suction catheter through the nares, you may need to complete this procedure using the oral route. Now apply intermittent suction for up to 10 to 15 seconds by placing and releasing your non-dominant thumb over the vent on the catheter. As you do, slowly withdraw the catheter, rotating it back and forth between your dominant thumb and forefinger, or by rotating your hand back and forth. Once the catheter is removed, rinse the catheter and connecting tubing by suctioning normal saline solution until they are cleared of secretions. When suctioning is completed, disconnect the catheter from the connecting tubing. Roll the catheter around the fingers of your dominant hand. Then pull your glove off inside out so the catheter stays coiled in it. Encourage the patient to cough. If she had an oxygen device, replace it and have her breathe deeply. Now assess the patient's cardiopulmonary status. If needed, repeat the suctioning after 1 to 2 minutes to allow for adequate ventilation and oxygenation. Then turn off the suction device and adjust the oxygen to the original level. Then help the patient back into a comfortable position. As part of your follow-up care, compare the patient's cardiopulmonary findings before and after suctioning.